Okay.
3, 2, 1. Hello everybody, Dr. Alex Earl here at Pure Plastic Surgery, and we are live. It is Hump Day with Dr. Alex Earl, and as many of you know, I get to spend with you guys talking about plastic surgery subjects and answering all your questions, all right? And today we are super excited because it's something new here at Pure. One of the first, we're going to talk a little bit about cellulite, we're going to talk about what it is, and then we're going to talk about what treatment options are available, and the one that we have now here at Pure, which we're super excited about. Okay, everybody hates it. Everyone have some degree of cellulite. Okay, by most women, I would say like almost 90%. Like it's a very high percentage of women that will eventually have some cellulite, whether we're talking about like a very mild form, maybe just 1 or 2 dimples here or there, to of course all the way on the spectrum to moderate and then severe cellulite. Okay, and so there's a lot of so of course from the outside, know what it looks like, estrogen, so you could get into like menopause, smoking and sun, or just anything that you do that may cause you to lose skin elasticity, actually massive fluctuation. All these things can affect the cellulite, then allows us. All these things can affect the cellulite, then allows us to then think about a treatment for this. Right? And the treatment is basically to release these bands. So you're able to bring something to a nice kind of smoother skin contour once again. Okay, typically that's a very kind of cumbersome device. It only treats like very small areas. It was an injectable, which was called Quo, and we had talked about that in the past. And what the quote was is this duration for losing it wouldn't go off the market. So basic treatment for cellulite, which is called Avali. You guys kind of see the name up there, Avali, right? No more cellulite nonsense. And so and I'm going to show you the device and how it works here in a second. But if you can see here, and then see whether are we able to see that there?
Yeah.
Cuts the band, so you're physically cutting or releasing the. It's a great device, which works really well. It's moderate, even in some cases a little bit more severe cellulite. Although for those cases you're probably gonna need certainly more than one session. But the cool thing about it is because you are like physically cutting these bands, they're cut forever. So this is a long-term solution for cellulite, not a temporary solution, but a long-term solution, which is really quite great. Okay, so how does that work? Well, the cool thing is that, well, obviously it's a device that comes in a sterile package, very similar to this. So it's all going to be done sterilely. The device comes in that sterile package just like that. But fortunately, because we recently had our training with it and we're like 100% good to go with it, we have a little demonstration device here so that I can show you. Okay, so here's the name. It's called Avali. All right. And what it is essentially it's like a little wand, almost like a small liposuction cannula, and so we put this underneath the skin, right? We got to be underneath the skin. It has to be between that skin and the muscle and that subcutaneous layer. We have to put that underneath the skin. We got to take it down to the point of where that cellulite dimple is, and then it has like a little knife on the side there. You see that here? There's like a little knife there, okay? And so what that does then is you physically you put it in without the knife. Once you're past the dimple, you have the knife comes out, you bring the blade out, and then you pull it back, and boom, you cut down all those fibrous bands that are causing the cellulite. All right. So very cool device, and there's a couple things that I really like about this. Number one, it can be done in the office or the clinic-based setting, okay? So you don't have to be in the operating room. You don't require general anesthesia or twilight or any type of like IV, type anesthesia. It can all be done under local anesthetic, which is great. So it can be done right here in the clinic under local anesthetic. It can be done by high-level providers, meaning nurse practitioners or physician assistants as well. So it doesn't necessarily have to be an MD or surgeon to do it. So that's also really, really cool. And it, it's basically an in and out procedure. It does take about an hour. So you're going to have to, it's going to take about an hour, but you have the procedure, you go home, there's not really any downtime, you can go to work the next day, no issues whatsoever, okay? Now, you may, in terms of how it feels, of course the worst part is just actually injecting that local anesthetic, so we got to put in that lidocaine, which is going to be a little needle there, but once everything goes numb, then you're not really going to feel anything. After that, you may have some pain for the first 24 hours. If you need a little extra pain medication during that time, we can always give you a little bit of Percocet or something similar to that. But after 24 hours, you're not going to need pain medication. You're going to be doing well with just Tylenol, or Tylenol, extra strength Tylenol. Or after 48 hours, you can take some ibuprofen as well. What are you going to see? Well, of course, you're going to see those dimples come out, right? That's the whole point. And you're going to see some bruising. There's definitely going to be some bruising, which may be there for about a week or two, and then that's going to go away. But you do have to think about it, right? Because you're not going to do this treatment, and then you're going to go in your nice little tiny bikini to the beach the next day because you're going to have some bruising there. Okay, so you got to think about that. But after about a couple of weeks, it's not going to be a problem. Okay. The incision, of course, is a very, very tiny incision. As you can see, this is way smaller than my pinky. So a little tiny incision, almost like just like a very large needle. Doesn't even need to be closed up. It just heals on its own. Okay? So a lot of really cool things about it. And the other thing that that people are going to ask is, well, can it be done at the same time as my BBL? I'm sure that's going to be the number one question on here. So here's the thing. It shouldn't be done in the same area where you're getting fat transfer. Okay, ideally you wouldn't do it So say if you have a dimple that's kind of out of the way, not exactly where where we're going to be doing the fat transfer, then that potentially can be done at the same time. Okay, but if it's in the same area where we're doing fat transfer, then it's best to stage the procedures. So typically I would think best to go ahead and do your BBL. All right, and then you can come back approximately 3 months later after you're fully healed from your BBL and then address all the areas of the cellulite. Again, remember, it's a one-time procedure. You're not coming back multiple times for this. And it's also a clinic procedure, meaning that there's no anesthesia. It's done in the clinic. It takes about an hour. You can go home the same day. Okay? So a lot of real cool advantages there. There may be some cases where you say maybe you have just like 1 or 2 dimples, right? That I may be able to do it all at the same time, because the one advantage of the fact that we use the ultrasound here in Pure is that we can see exactly where we're putting in the fat, right? And so if you're someone where we're going to be doing okay with just putting the fat in that deeper subcutaneous plane, and you only have 1 or 2 dimples where we're going to be releasing that a lot more superficially, then that potentially is something that we can do as well. But that's going to be taken very, very much on a case-by-case basis. Okay? All right. Questions about Avali or anything else for that matter?
Yeah, but we need some likes before the questions. So ask for the likes, dog.
Oh yeah, we're on TikTok.
Yeah, everywhere.
On, guys. Yeah. Go ahead and send us those likes. You know what I love in TikTok? I love the dinosaur. Hopefully we can get a dinosaur here today.
Okay, let's wait for at least one dinosaur today. Okay, let's start with the question. If a girl has really skinny legs, will you transfer some of her fat to the other part of her thighs?
So we don't do like fat transfer specifically to the thighs, in the sense that we're not going to be transferring the entire thigh. But what I do is I do transfer a little bit of fat to that kind of upper outer thigh area to kind of blend in the BBL, right? So we're looking to kind of course, fill in the hip dips, maybe expand the hips a little bit. I have to make sure that I have a smooth transition, and that's really what we're all about here at Pure. I know you've heard me talk about the South Beach butt lift. And one of the key differentiators of that between just your regular BBL is that it's all based on your unique frame and foundation, and all the transitions need to be nice and smooth. And so if I need to place a little bit of fat in that upper thigh area, to make sure that it transitions smoothly, then I will definitely do so. But don't think of it though as like a full fat transfer to the thighs where I'm really like, making the entire thigh thicker.
Okay, Doc, you got the dinosaur,
All right.
you got the legs, and also now you're wearing a hat and a mustache. I don't know
All
what that
right.
means, but
All
it's
right.
funny.
I like it.
Okay,
I like it.
okay. Let's go with another
Get
question.
ready for November, a
Be-
little later this
wait,
year.
wait, wait. No, I'm not ready. Yeah, this, and she is in reference to the Aveli, could be
Yeah.
with my mommy makeover, could be done with my mommy
Yeah,
makeover.
that's a good question. So what other procedures can I combine it with? Well, actually, you can combine it with pretty much any other procedure. So you can certainly combine it, say, with a breast procedure, a tummy tuck, your mommy makeover, really anything else where we're not like physically transferring fat to the same area where we're using the ovally device for the cellulite. Okay, if you're coming for any of those other procedures, definitely something that we can add on for sure.
Okay, this question is here at TikTok and say,
Alright.
what's the recovery time from lipo, side flanks, and lower tummy? Looking to resume my workouts.
Right, so in terms of going back to the gym and working out after liposuction, whether it's 180 or 360, I'm going to say 6 weeks, okay? You want to take it easy for the first 6 weeks. In the first 6 weeks, you can walk. You can do all the walking that you like, but you shouldn't do anything more vigorous than that. No running, jumping, jogging, working out, going to the gym until 6 weeks post-op.
Thus, getting lipo 360 results in fat accumulation in organs if there's significant weight gain.
It can, yeah. So when you say organs, the technical term for that is called visceral fat. All right. So if you do liposuction, right, by definition, we're removing a whole bunch of fat cells. After one becomes an adult, the number of fat cells is actually fairly stagnant. Like it's not changing. Okay. And so if you permanently reduce fat cells, with liposuction, that's permanent, and then after that you start to gain a whole bunch of weight, then whatever fat cells are left behind, whether they're superficial or deep with the organs, that visceral fat, those fat cells are going to start to get bigger, okay? And then yes, potentially then your visceral fat will start to increase, and then you'll see more of that kind of that almost like pregnancy looking belly because you have more fat with the organs there.
Can mild fibrosis be correct?
So let's talk about fibrosis for a little bit. So fibrosis is a risk factor with any liposuction procedure, okay? It's riskier in patients that are actually, the thinner you are and the older you are, the higher the risk of fibrosis, okay? I've also seen it more in people with loose skin. If you have skin laxity, the risk is also higher. How do you treat fibrosis? Well, the first thing is to try to prevent it. The surgeon needs to try to prevent it by not being overly aggressive and by leaving at least 1 centimeter of fat underneath the skin there, okay? The patient then has to be, very, very compliant with their post-op care, which means their compression and their massages. The massage has to be done by a professional post-lipolymphatic massage therapist, and you're going to need at least 20 massages. Okay? Now, there are certain cases that even if you do all that, you may develop certain areas of fibrosis. If it's under a year, there are non-invasive treatments that can help, such as carboxytherapy, ultrasound therapy, radiofrequency therapy, and cavitation. Okay? Oh, and wood therapy. Wood therapy is actually a big one, sorry. Now you're going to try that. Now if after a year you've tried all those modalities and everything else and you still have some areas of fibrosis, then yes, the next step is then to do a repeat quote-unquote liposuction procedure where you have to go in and you have to kind of break up the scar tissue with the cannula. You may do some suction in certain places, you may not in others. You try to break everything up and basically get everything to be smooth again and then start from square one, going back to your compression and your massages.
If I want to lose some weight after a BBL in about 6 months, will I lose my BBL as well?
All right, so there's one thing you said which is actually very, very important. You definitely don't want to do that within the first 3 months, and you say you're waiting for at least 6 months, which is good. In the first 3 months, you want to make sure you don't lose any weight whatsoever. You want to stay at your baseline weight, perhaps even gain 5 pounds, but you definitely don't want to lose weight in the first 3 months. All right, 6 months has passed and you want to lose a little bit of weight. If you lose something that's reasonable, my reasonable I would say 5 to 10 pounds, it shouldn't affect your BBL too much. Now, if you're going to be losing more than that, then yes, the fat in the hips and the buttock that was transferred is going to act like the fat in the rest of your body, and so then that fat's going to decrease, and then yes, you're going to lose some fat or some volume to the hip and the buttock area.
Okay, Doc, this is to. How do I know which kind of implant to choose, if silicone or saline?
Okay, so if we're thinking about silicone versus saline, typically I would say choose silicone, okay? But we're talking about safety profile, they're both equally safe. No study to date, and there's been thousands of studies, has shown that silicone or saline, either one is safer than the other. So they're both equally safe. I do think the silicone has a more natural look and feel, so that would be my recommendation. I think the saline implants have a higher risk of what we call rippling, and that's where sometimes you can see some waviness, through the skin after having an implant, especially if you don't have a lot of breast tissue or thin skin. Okay. The only time where I would choose a saline implant above a silicone implant has to do with age. So here in the United States, you need to be 22 years or older for silicone implants. So if you're under 22 years of age, then you're going to be looking at a saline implant.
Is it safe to get a round 2 or 3 of BBL?
So round 2, round 3 is all taken very, very, very much on a case-by-case basis. But I would say, especially round 2, for round 2, definitely safe. I think for the most part, it's a reasonable thing to do. Many patients will need a round 2 for one reason or another, whether they want to have more fat placed in the hips. The hips is notoriously a place where the fat tends to absorb a bit more, whether they just want more projection, whether they want to change their shape, etc. Round 2 is not uncommon. I would say almost 20 to 25% of patients that have a BBL will come back for a round 2. Okay. Now round 3 does get more tricky. That's going to be taken on a case-by-case basis. You got to see what the skin looks like, how much fibrosis there is, if any, how much scar tissue, things of that nature. Those cases can be very, very challenging sometimes, and so I have to make a full assessment, look into your medical history, your surgical history, your background, do your physical examination, your photos, your videos, to determine whether it's worth attempting to do a third round.
Okay. Question, is it possible to only get the love handles lipo? My bestie wants to know.
Yeah, it's possible. If that's the only area you want to address, certainly it's a possibility, but I will tell you this. Love handle is all this, right? So there's not just like one plane to the love handles. In other words, if you just try to hit it from the front, that's not going to be enough. So you got to hit it from the front and the back to really address that entire area.
Okay, let's go. Opa, sorry, dog. Is there such a thing as a fluff stage on a BBL? Is here at TikTok?
Yeah, so I'm a big believer in the fluff fairy, as you say, or the fluffing stage. And I talked a little bit about this not too long ago. But here's what happens, right? So this is volume, right? And this is time. And after surgery, you're going to have all the fat that we put in plus all the swelling, so your volume is going to go up, okay? And then what happens? Well, that swelling is going to come down, and we are going to lose some fat. No matter how perfect and compliant the patient is, we always lose some fat, and the average loss is about 30%. So we're going to decrease at least 30% in the fat, and we're going to, of course, lose a lot of the swelling. Okay, but what I can tell you is that you're then going to hit a low point somewhere around 6 weeks. 6 weeks is going to be your lowest point. Okay, that's also when sometimes patients begin to freak out a little bit because they've lost some of the volume and their waist hasn't shrunk down as much as it's going to shrink, and things are looking a little bit wonky, and so that's when patients sometimes get discouraged. And that's part of the whole physical and emotional roller coaster that we talk about. So what I would say is don't get discouraged. You are at a low point that everyone goes through, okay? Because after that, you're going to hit the fluff phase, okay? This is the fluff phase, and that's going to be around 3 months. Somewhere around 3 months, you're going to hit that fluff phase. And why does that happen? 2 reasons. One is after you've lost the swelling, you've lost some amount of fat, that fat that does survive, that 70% or so of fat that does survive has survived and it's alive, but it's suffered, right? It's kind of been like traumatized. And that fat is kind of, it's shriveled, right? The fat cell, the fat cell which may normally be this big is now this big because it's gone through some suffering and it's dehydrated, okay? And then that fat cell begins to hydrate again and begins to plump up, fluff out, if you will. And so the fat cell becomes big again, okay? And that's what the fluff phase is. And the second part is, mixed up with these fat cells, you have little, what we call stem cells. And these stem cells can reproduce and create a few more cells. So the combination of your fat cells rehydrating plus some of those stem cells creating a few more fat cells, that combined is what causes the fluff phase, and that's when the fluff fairy comes to visit you. But in order for that to happen, you got to make sure that you feed the fat. It's so important that you feed the fat. You got to increase those healthy fats in your diet, okay? Avocado, eggs, salmon, okay? And if you need a little boost, go for some ice cream, some milkshakes. You got to make sure that you don't lose any weight at all in those first 3 months, and that you perhaps even gain, up to 5 pounds. All right? Okay. All right. I want to do a shout out. Are we done?
Yeah.
That's it? 30 minutes?
Yes, dog.
My Lord. Okay. Well, that went by super quick. So once again, super excited about Obali. Okay. So Obali is our new treatment here for cellulite, available at Pure, one of the first clinics down here to be able to offer this treatment. Super excited about that. Also, I want to wish all the women out there, I'm sure a lot of you on here on the lives are women, so I want to wish you all a very, very happy International Women's Day. It's been a great day here today for our staff and for our patients, so thank you all so much. And I want to make sure that you all come back, all right, next Wednesday on Hump Day with Dr. Alex Rowe. I'll see you later. Ciao.